drop a like and comment your story for a chance to be featured in the next video. Doctors of Reddit, what's your thank god they came in for a second opinion moment? Psychiatrist here. A 30-year-old man with mild depressive symptoms was in and out of the hospital fairly quickly. He was under pressure from his home life, living with 4 roommates who were making life a bit difficult for him. No suicidal thoughts. He was cleared of all psychopathologies by me and 2 other doctors. A few months later he came back. Same symptoms, however this time he talked about 5 roommates. It felt wrong, and I digged in his story. Tried to contact his roommates. He lived alone and was severely psychotic. I have no idea to this day how he hid it so well from everyone. My grandmother had her hip replaced, but the hip always hurt to her. She waited a year, hoping it would go away, but it never did. She asked multiple doctors and did multiple x-rays, but doctor said the replaced hip was fine. We finally made her go to a private clinic in my hometown, and the doctor saw that the replaced hip was fine and indeed, but the bone around it looked like it was a tad bit eaten by bacteria. So the new doc did an operation, and there was so much pus in the leg it was insane. If my grandmother waited any longer, her blood would become infected and she would have died. Thank goodness she went to the clinic. This guy was told he had pink eye. He had metal shards in his eye from welding. This is a I wish I had gotten a second opinion story. I had a doctor in high school who was unconcerned when I suddenly developed vertical double vision, which was freaking out everyone in emergency, where I had gone initially, and lost 60 pounds for no reason. It was only a year or 2 later when I told him that my arm would fall asleep much faster than normal when I raised it to ask a question in class that he thought there might be something wrong with me. MRI ordered. Brain tumor found. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test. So I ordered a peripheral vision test. When I got the test back I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180, energetic and happy. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine, that were melanimous. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this. Time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. I went to my former doctor about a mole on my arm that I thought had gotten larger, and asked him to biopsy it. He looked at it carefully and told me it was fine, but I insisted and things got a little testy, but he did it. It was a malignant melanoma, and had it gone 1 mm deeper I'd have been grounded for 5 years from my pilot job at best, or suffered dire health consequences at worst. After a surgeon removed a big chunk of my arm excising the melanoma and surrounding tissue, he told me to be sure to thank my regular doctor for saving my life. In the time since I've become well acquainted with your specialty as my first line of defense, having moles mapped and checked every 6 months for a while, and now every year. It sure as hell isn't all botox and laser hair removal. ER nurse here. Had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. My dad, a pediatrician specializing in neuro issues, was seeing one of his patients at the hospital got dragged into the NICU unexpectedly by a nurse who insisted a baby wasn't well. The attending doc insisted the kid was fine and just tired from a difficult vacuum assist delivery. My dad could tell the baby wasn't okay and managed to talk the parents into a brain scan. The NICU doc insisted my dad was nuts to the parents. Dad was right and the kid had a brain bleed and was rushed to surgery. The baby would have died without the nurse bringing my dad in and the parents listening to him. As is, that extra time almost certainly cost brain function. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he'd done goofed and that I would be talking to our mutual chief of clinical services about the incident. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left they got a second opinion saying it was pneumonia. Then they got a third that again said it was pneumonia. Now several years later she is healthy and never got cancer treatment and has been tested for cancer regularly. Former ER volunteer here. An elderly gentleman was brought in by his concerned adult children for chest pain. He wanted to believe his primary doctor that it was just some gas or heartburn, but his son just had a gut feeling and made him go to the ER with everyone so he could get checked out. Heart attack was imminent, we weren't sure if treatment would take effect in time to prevent it. Declared code blue, all hands on deck. Place went from a quiet, empty ER to sheer chaos in a few minutes. There is no doubt in my mind that that gut feeling saved his life. In 2002 I started vomiting everything I ingested. About that time my hands and feet became darker in color. I had no insurance, but my mom paid for me to see my family doctor. For 2 years he would give me nausea medicine and cautioned me to stay out of the sun. The darkened color of my feet and hands traveled toward my torso and I began to lose weight at an alarming rate. On the 3rd of January, 2004 my friends picked me off my bathroom floor and took me to the emergency room. I was 5 feet 6 inches and weighed 100 pounds. I was severely anemic and suffering from malnutrition. The hospital admitted me and the next day a gastroenterologist visited me. After talking about all my stomach issues, I asked him why I was so dark. I showed him a picture taken several years before where my skin was Irish pale. He went home that night and did research. The next morning he ordered blood work and told me I have Addison's disease. AD is an adrenal insufficiency. If it is not treated, AD is fatal. The doctor also told me I was within hours of dying. My friend saved my life that day. Now, 16 years later I am getting along pretty well. I take steroids and a lot of other medications. My skin stopped bouncing back to its original color so I look extremely tanned. I am so thankful for that doctor who diagnosed a disease that nearly killed me. It will one day, but not today. My son was about 1 month old and was shitting small amounts of blood. And getting worse, pediatrician ignored us because new parents. Second trip to pediatrician and I refused to leave. It said something is wrong and we aren't leaving. About that moment he shit his diaper full of blood and the pediatrician freaked out and sent us straight to emergency. The doctors there ordered several different bacterial tests. Just before they sent the test upstairs, an old doctor came in, asked us a few questions and told the tech to test for one more type of bacteria. That was the one. C. diff 25% fatality rate and treated. Worse in infants. Thank you, old man doctor. I am a semi-retired physician and I don't believe in second opinions. I much prefer to first opinions. Edit. Thank you, readers. Never thought these 2 sentences would explode like this. Thank you very much for the silver and gold. Thanks still who follow. I can't count how many I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else I've seen. Of course, those are the patients that are the nicest and are profusely apologizing for wasting our time. And of course, those are the patients that have a brain tumor show up on their CT scans. Drop a like and comment your story for a chance to be featured in the next video.